You exercise, you take your medications, you watch what you eat, and your doctor tells you you're doing great. But there is one thing you are almost certainly doing every single day, right now, today, that a growing body of research says may be doubling your risk of a fatal heart attack after 70. And your doctor has almost certainly never mentioned it. I'm Dr. Hayes Anderson, and after 22 years in senior health, I've seen firsthand what happens when this silent habit goes unaddressed, even in patients who are doing everything else right. By the end of this video, you are going to understand exactly what this habit is, why it is so dangerous for the aging heart specifically, and, most importantly, the remarkably simple fix that can begin reversing its damage starting today. But first, I need to tell you something that stopped me cold when I first studied the research, because what I am about to share contradicts something most people believe with absolute certainty about their own health. And I need you to hear it, because millions of seniors are unknowingly doing this every day, thinking they are safe. Here is what the data actually shows. If you sit for more than 8 hours a day, and most Americans over 70 do, your risk of a fatal cardiovascular event is elevated significantly, regardless of whether you exercise. A landmark study tracking more than 45,000 adults found that people who sat for long, unbroken periods faced dramatically higher cardiovascular mortality, even when they met all standard physical activity guidelines. The researchers called it the active couch potato paradox. You go for your walk in the morning, you feel virtuous, then you sit for 6, 8, 10 hours, and your heart pays a price your morning walk cannot fully undo. Before we go any further, I need to plant a number in your mind, a number I am going to come back to in just a moment. The number is 30. Remember it. Let me tell you about Harold, a 73-year-old retired contractor from Ohio. Harold was one of the most health-conscious patients in my practice. He walked 2 miles every morning without fail. His diet was reasonable. His blood pressure was managed with one medication. When he came in for his annual visit, I asked him a question I now ask every patient over 65. Harold, after your morning walk, what does the rest of your day look like? He looked slightly confused. He said, I come home, have breakfast, and mostly relax. I watch the news, read, maybe some television. When we pressed further, Harold was sitting, essentially without interruption, for 9 to 10 hours every single day. His morning walk was real. His commitment was genuine. But between the front door and bedtime, his body was spending most of its waking hours doing something that was quietly working against everything his walk had built. So what is actually happening inside the body when you sit for prolonged periods? This is the part most people never hear explained, and once you understand it, you will never think about a chair the same way again. When you sit for extended stretches, your major leg muscles, the largest muscles in your body, go almost completely inactive. And those muscles are not just for movement. They are metabolic engines. They are responsible for clearing glucose from your bloodstream, regulating inflammatory signals, and, critically, keeping blood moving back up toward your heart. When they shut down, blood begins to pool in your lower legs and feet. Circulation slows. A clotting protein called fibrinogen rises in your bloodstream. C-reactive protein, one of the most reliable markers of cardiovascular inflammation, climbs measurably within a single afternoon of unbroken sitting. And your arteries, already stiffer after 70 than they were at 50, lose additional elasticity with every hour of stillness. Your heart, meanwhile, is working against progressively thicker, slower-moving blood in vessels that are becoming less responsive. This is not a slow, distant risk. This is a biochemical shift that begins within 60 to 90 minutes of sitting down. And here is the part that I find most alarming in clinical practice. Many of my patients who sit the most are also the ones who feel the least able to move. Joint pain, fatigue, breathlessness, these are real barriers. But here is the difficult truth. Prolonged sitting is one of the primary drivers of the very fatigue and joint stiffness that makes movement feel impossible in the first place. It is a loop. Sitting causes inflammation. Inflammation causes pain and exhaustion. Pain and exhaustion cause more sitting. And the heart suffers quietly through all of it. Stay with me, because what comes next is the part that changes everything. And it is far simpler than you might expect. This brings me back to the number I asked you to remember, 30. 30 minutes. That is the maximum amount of time you should sit without interruption if you are serious about protecting your heart after 70. Not 2 hours, not 1 hour, 30 minutes, and then you get up, even briefly, even for 60 seconds, because those 60 seconds of standing trigger a measurable reset in your leg muscles, your circulation, and your inflammatory chemistry. That reset is what your heart has been waiting for. Let me tell you what happened when Patricia, a 71-year-old retired teacher from Georgia, applied this one change. Patricia had experienced 2 episodes of atrial fibrillation, an irregular and sometimes dangerous heart rhythm, in the previous year. Her cardiologist had addressed her medications, her diet, her stress. But when we looked at her daily movement pattern, Patricia was sitting for up to 11 hours a day, reading, watching television, talking on the phone with her grandchildren. We gave her one instruction: set a timer. Every 30 minutes, stand up and walk to another room. That is it. No gym, no special equipment, just interruption. Within 8 weeks, her inflammatory markers had dropped measurably. Her energy had improved noticeably. And at her 6-month cardiac follow-up, her cardiologist noted that her arrhythmia episodes had decreased significantly. Now, I want to be clear about something important. I am not telling you to run a marathon. I am not telling you to push through pain or injury. And I am absolutely not telling you to change any medication or treatment plan without speaking with your own physician first. What I am telling you is that the research is overwhelming. Breaking up sitting time is one of the highest impact, lowest effort cardiovascular interventions available to adults over 70. And almost no one is talking about it. The 5-minute walk to the kitchen, standing during a phone call, getting up during a commercial break. These are not trivial gestures. Each one triggers a measurable reset in circulation and inflammation. Done consistently across a full day, the cumulative effect on your heart is significant in ways that a single morning walk, as valuable as it is, simply cannot replicate on its own. Let me tell you about one more patient. Frank, 78, a retired accountant, was deeply skeptical when I explained this to him. He said, "I already feel tired. How is getting up supposed to help?" I told him what I am telling you now. The tiredness is partly the sitting itself. He set an alarm on his phone. Every 30 minutes, he stood and walked to his window and back. Within 3 weeks, he called to tell me something I hear regularly when patients make this shift. He said, "I cannot explain it, but I have more energy in the afternoon than I have had in years." His wife called it a personality change. His heart, I believe, would agree. None of this is complicated, but it requires a decision made today, not tomorrow. So here is what I want you to do before this video ends. Decide on one simple trigger: a phone timer, a television commercial break, an alarm on your watch that will remind you to stand up every 30 minutes. That is your starting point. One trigger, one habit. And if you want to take it further, a short walk to another room, a few gentle calf raises while standing, a slow loop around your living space. Each of these activates the muscle systems your heart depends on, systems that have been waiting quietly for a signal to wake back up. Your heart has been working every second of your life without a single day off. It has never asked you for much. Today, all it needs is for you to stand up. Now I want to hear from you. Tell me in the comments, how many hours a day do you think you sit? Be honest. Most people are genuinely surprised when they actually count. And if this video opened your eyes to something your doctor has never mentioned, share it with someone you love. A spouse, a sibling, a friend. This information could change what happens to their heart.